Public Health Ontario says 78 new measles cases have been identified over the last 2 weeks, bringing the total number of cases to over 140. The outbreak is renewing concerns about vaccination rates and the risk of community spread. Measles is a highly contagious virus that spreads through the air when an infected person coughs or sneezes. Symptoms include fever, cough, runny nose, and a red rash.
The problem is a fever and a rash isn't super concerning, but what can manifest afterwards, like the secondary bacterial infections, things like pneumonia, ear infections, and severe encephalitis, sort of a brain infection. That's where we really see a lot of the severe disease that needs hospitalization and unfortunately can lead to death.
Officials say the last time there was a sizable outbreak in the province was in 2008, when there was a total of 58 cases. Between 2013 to 2023, there's only been roughly 100 cases, and this latest outbreak is well beyond that.
These are outbreaks in Texas and in Ontario that are being fueled almost entirely by people who didn't bother getting vaccinated against measles. It is an exceptionally contagious disease that, as we've seen in the outbreak in Texas, has led to a child dying. And it's a disease that is easily preventable.
The epicenter of Ontario's outbreak has been in the southwestern and Grand Erie public health regions. As a result, 18 kids have been hospitalized in Ontario, including one who required intensive care. Both York Region and Toronto Public Health have confirmed one case of measles.
The issue with trying to contain this is it's one of the most infectious viruses. Essentially, if you're in the same room or airspace as someone who's infectious, and you're not immune, you have a 90% chance of contracting this infection.
Those most at risk are small children, pregnant women, and those with weakened immune systems. Health officials are urging the public to get vaccinated if you haven't already to prevent the spread.
The vaccine is highly effective. It's highly safe and effective against getting infected if you are exposed. And again, it's that 2-dose that gives you really high levels of protection.
Health officials recommend checking your vaccination records and watch for symptoms if you've been in contact with an infected person. If you suspect you have measles, it is advised to stay home and call your doctor. In Toronto, Catalina Gillies, City News.